Hello and welcome to Beyond the GPA's video series, Preparing to Launch. I'm Anna Maria Wenner.
And I'm Maura Mulligan.
And today, Maura, we're going to talk about mental health. In our first video series, you did a wonderful job covering a very broad spectrum of mental health and wellness as it impacts college students. But for this particular video, you're going to really focus on the high school students who are managing some mental health concerns and how best to make that transition successfully to high school, to college. So with that, I'm interested in learning what you have to say. So I'm gonna hand it over to you, Maura.
Great, thank you. Hi, everyone. And so I wanted to talk a little bit about student mental health. I've been working in college mental health for about 20 years and have seen so many students coming into college and really having their first year of college derailed by some common mental health issues. And we're seeing more and more of those students are coming to college already sort of having been in treatment in the past. And so the most common things we're seeing for students, and for those of you who have adolescents, you're probably seeing this as well, if not with your own student, but with their peers, depression and anxiety have really increased in recent years for students and made a little bit worse during the pandemic. And we know that many students are seeking support before they even get to college. They have outside therapists, they may be seeing a school counselor at their high school, maybe talking with family members, maybe having a psychiatrist and taking medication. That's really different than how things were 10 or 20 years ago. Those numbers have really increased. And one of the things that is really hard to see sometimes for students, that's where I really want to focus on this for senior year for students, is sometimes students graduate high school and they feel like, I'm starting new at college. I'm going to be a brand new me. I want to try things different. I don't need that therapy. I don't need that medication. I'm going to be good. And it's all new and I'm feeling good because it's the summer. And just, in terms of from what I've seen, that tends not to go very well for students. And so I really encourage families and students to think about senior year and really making sure that support's in place. So if you have a student struggling with anxiety, having trouble socially interacting, having trouble managing the academic work, and really having a lot of anxiety, or really struggling with depression and getting out of bed, or having trouble socializing because of depression, and don't wait. Really take advantage this year, if you haven't already, as they're coming into the end of their high school careers, to get them some treatment and support, because when they get to college, they're going to be managing many of those things on their own, especially if they're living away from home. And so the more skills they can learn the senior year before they go off to college, the better. And then really what we sort of recommend to people, and that's really so important as well, is make sure you're keeping that transition going to college. We know that for 6 weeks of college or so, 6 to 8 weeks, is a time of significant transition for many students. And for our students who have had a mental health history, anxiety, depression, trauma, whatever it might be, that's sort of ramped up a little bit, right? There's lots of new things, new classes, new environment, sometimes a new city, living somewhere new friendships, new academic load, things like that. There's just so many things that can be overwhelming. And so really making sure that that's not the time to scale back on services, but to increase them. So, my tip again is to not use the time now to sort of wait and see how things go. But if you're sensing an issue with your student that hasn't been addressed, to take this year that they're in high school and get them the support they need, have them build those skills so they can manage their mental health issues on their own, so they have some good skills in terms of self-care. And then to be thinking about, if they're doing well, not dropping that off when they go to college, but continue that at least for that first semester. Make sure they're aware of counseling services on the college campus that they're going to. If they have outside counselors, making sure that those services remain in place until you can feel secure that they've transitioned well to college. So I hope that is helpful. If you want to learn more about that information or talk with us more, please feel free to visit our website at beyondthegpa.com. Thanks very much.